All right, awesome first day. We are to our last official session in this room. And if you haven't figured it out, we've tried to intersperse throughout the meeting things that, in addition to just how we manage patients with kidney cancer, but things that also make us better doctors, better human beings. So this session is really about professional development and how we can all be better together as physicians, as people, as parents, as husbands and wives, and how we can do that together. So we're going to start with just a brief talk on institutional wellness, and then we're going to actually break out into work groups and small work groups. So I will say these again so you don't have to remember them. They're also in your book, but I'm going to take a group over to Music Row 3. Anybody who wants to talk about complications, death, and the way they affect us as providers. There will be Brian Reaney and Tian Zhang. We'll talk about starting an early career over on this side of the room, Tian? I think so. And while Kim Rathmel, Dan George, and Brad Leibovich are going to head over that way to talk to people about the mid-career itch. Yep. And then the last is Jose Perez. Jose, if you're in here, give a wave. Is going to take people to EFG for 30-minute sessions. So with that, we'll have a quick talk on institutional wellness so we can kind of all process that. And we really want to spend the time in the small groups, so we're going to cut this talk a little short as well. Following this session is the networking reception and the poster walks, which will happen next door. And we look forward to interacting with you more this evening. So with that, here we go. Okay, so I'm going to talk to you about promoting institutional wellness. And we were supposed to have Tate Shanafelt and Jay Shah, who are both from Stanford Medicine, and they are incredible leaders, and Stanford is an incredible institution in leading in wellness. Unfortunately, neither of them could be here this evening, so you're stuck with me for the next 15, 20 minutes, just while we kind of talk through some of this. By way of disclosures, I do have a podcast. A number of you have listened to it. A number of you have participated and given great thoughts. I make zero money on that, but it is on the topic of wellness and how we can be better as surgeons and physicians. So the outline for the objectives for our talk today, and these will kind of weave in and out, so it's not going to follow a particular order, but address first what's the problem and why institutional wellness is important, how we can think about solutions, both as individuals and institutions, and how can we solve those. So just really brief data. This is not meant to be a downer at all. This data is a little bit old, about a decade old now. But burnout is real, and it's burnout and real in oncologists. You see about a third of medical oncologists and radiation oncologists, and as well as surgical oncologists, which includes urologists. The urology data is really profound, and there was a AUA census 5 years ago and another one in 2021, and burnout rates have not changed at all, despite everybody being very, very aware of this. Importantly, it's increased in women, and it's increased in our young surgeons. And so we're becoming very, very, very aware of these issues. Why does this happen to us? Well, first, we're incredibly detail-oriented, which means we can be a little compulsive. We're altruistic and service-oriented, which means we often become exhausted by overcommitment. We have a lot of skills. We went to school for a lot of years. We practice this, right? And sometimes that leads us to feel like we can do it all. However, we do have insecurities. Imposter syndrome is prevalent, and there's a lot of false norms in our fields. We're taught rigidity, right? That there is a single best approach often to what we're doing. We saw that in some of our debates today. We learn to blame frustrations on others, including the disease states, including patients. And stress and burnout is often seen as a badge of honor. This is something we're supposed to go through, but it isn't. And so I love putting up this number. 20% is a really important number to remember when we think about wellness. And the first point of that is only about 20% of our burnout or wellness on the flip side is attributable to the individual. At least 80% of this is the systems around us, and that's what contributes to it. On the flip side, 20% of us 20% of our wellness we have complete control over. And so there's two ways to think about this. The first is work on your 20%, and if that's not enough for you, then you can work on the other 80%, but you got to climb the ranks. You've got to be able to affect the systems. So don't waste energy and time complaining about the 80% if you're not interested in climbing the ranks to fix it. Focus on yourself. And then the last 20% that you need to know is we really only need to spend 20% of our time doing what we truly enjoy doing to really achieve happiness and to mitigate those effects of burnout. It's kind of sobering, right? That's 1 day a week. This data has been reproduced in Google, in industries across the world, and in medicine. So if you set the bar that 100% of the time you need to be doing what you love, you are setting yourself up for failure. We can aim for more than 20%, but if you set the bar at 20%, it's a lot easier to achieve a good feeling on a weekly basis. Importantly, our institutional identity supports our individual identity and vice versa, and we'll talk through a little bit of that. One of the big problems and issues, and I think one of the leading causes of burnout in our field, is cognitive dissonance. And this is when it's a mental conflict that happens when our beliefs don't line up with our actions. And there's a number of kind of causes for this. The two big ones we see in medicine are forced compliance behavior, when we have to act against our own beliefs. And this doesn't necessarily have to be something big and unethical, but this is when an insurance company tells you you can't prescribe the medication you want, you can't order the lab you want to do, right? So it's a real challenge to who we are. And then the bottom one is really important. When we put in this great effort, which we've all done for decades, and then sometimes consider or realize that maybe we're not that important, maybe we're not that special. And that stresses us all out on a weekly or monthly basis. Meetings like this, seeing each other, and seeing all the great work done can sometimes combat that. And I would make the argument to you that some of the biggest struggles we see in medicine and in our colleagues and in ourselves originate in identity confusion. We've all seen this. People who think they're someone other than they are in the practice, or think they're someone other than their chair thinks they are, or think they're someone other than their institution thinks they are. And it causes real struggle. And Brad Stolberg, in this great book called The Practice of Groundedness, talks about when our being is misaligned with our doing. Andres, you read this book, you know this one. But if we can bring our being and doing in alignment, we can reduce that cognitive dissonance and really help ourselves. And identity is the best way we can do this. And we can do this on an individual level, work on our own identity, and we could do it at an institutional level. And one of the great analogies is if you're a smoker, you can either be a smoker who's trying to quit, or you could be a non-smoker. And the people who identify in the second category have a much higher chance of quitting smoking durably than others. And there's real neuroscience behind this. This becomes a cognitive action as we take things from our frontal brain where we're thinking about them, and it becomes more innate. So there's a lot of science to actually back this up. One analogy here is work-life balance, and I hate this analogy, the up and down, right? As one goes up, the other has to go down, and that's really false. We're much more complex than that. In at least the sociology literature, there's at least 8 dimensions of wellness, and we're probably more complex than that. And so those of you who did yoga this morning know this. I kind of think of balance now as a complex yoga pose. It's challenging, it can be occasionally painful, it requires skills, and there's pushes and pulls to it, but we certainly can work in directions that are beneficial. And I really like this model. This is from Stu Friedman, who's actually a professor at Wharton at Penn. And this is what most of our lives look like. We give a big, the red line is kind of our energy, and we give a big chunk of our energy to work in what we do as physicians. It overlaps a little bit with home and self, and we often neglect our communities. But as we overlap and bring these into alignment, we can decrease psychological stress, we can increase our discretional energy, and we can become happier, better people, whether that's as an individual or an institution. Once again, just a different model. By pushing that energy in one direction instead of letting it diffuse in multiple, we can become happier. And this is a science paper, now over a decade old, but this talks about different activities we can do, and ones that are really require focus and being present, and ones that allow diffusion of energy. And interestingly, I highlighted in yellow the ones that really require focus or presence: working, self-care, reading, praying or worship, cooking, exercising, making love. And the ones that make us happiest are the ones when we are focused, when our mind is not all over the place. And so really being focused. And so the mind grounded in the present is truly happy. So I'll finish here with a couple of strategies for wellness and then move on to our sessions. So this is from Tate's work, and there are really 3 general principles to improve institutional and individual wellness. First, recognize that burnout is not a rite of passage. just because we went through it doesn't mean the next generation has to go through it, and we can make it better for others so that we don't have a broken practice environment. Second is we need to assess our organization's situation. A lot of us throw out solutions without truly understanding what we need. Yeah, yoga's great, meditation's great, but that's probably not what your group needs. And I can tell you what the surgeons need are going to be different from what the medical oncologists need, or is different from what the radiation oncologists need. And so we really need to assess what we need at different levels, and then prioritize where to focus energies. We don't have all the resources in the world, but we can chip away at this step by step when we focus on individual outcomes. It brings us to emotional intelligence, and emotional intelligence affects us as an individual and in larger groups, and they are relational. It starts with self-awareness, but that self-awareness allows us to empathize and work within organizations, and also brings us back to manage ourselves as individuals in those relationships. And emotional intelligence has a huge impact on our institutional outcomes. And this is, once again, a model from Wharton, but it talks about leadership practices and organizational climate, but one of the biggest pushes for results and outcomes is actually emotional intelligence in our leadership, and that goes for everybody in this room. Unfortunately, stress adversely affects emotional intelligence, and all of these things, from self-awareness to our abilities to work in relationships, suffer when we're stressed and burnt out. And so it really is important to kind of work on these things. So Stanford's come up with a model, and I'll show you just a couple of models here, of professional fulfillment. And it's not quite 80%, they break it into thirds, but when Tate talks about it, the culture of wellness and efficiency of practice, he really is talking about the 80% that's out of our control. And so in this model, in the culture of wellness, this is our work environment, our values and behaviors that promote personal and professional growth. These are things like infrastructure, transparency and values. When we talk about efficiency of practice, this is our workplace systems, processes, and practices. These promote safety, quality, effectiveness, and positive interactions, things like work-life balance. And this helps us redesign our EHRs, reduces some of the clicks, things that make our lives better on a daily basis. And then we've got the personal, the 20%. These are the individual skills and behaviors that promote our physical, emotion, and professional well-being. Not only are these support systems and safety nets, but these are places that provide professional development, help us grow, help us become the person we want to be as a professional and as a person. Penn, and a lot of, I only highlight these two institutions, but a lot of you are working on now high reliability organizations. This is the Penn Medicine High Reliability Framework, and you can see culture is a huge part of it. Learning and professional development is another part of it, which is tied into knowledge. And part of this is personal accountability, that we hold everyone to the same standards, differentiating for personalities and behaviors. And importantly, we hold everyone to the same standards, have the courage to speak up, listen actively, to be authentic with each other. And how can we do this? I'll give you my quick individual plug. So mindfulness has the ability to enhance our attentional abilities. And Amishi Jha is a 30-year researcher on attentional abilities. And I'll save you the punchline of Peak Mind, which is a great book. You can do lots of things to improve your attention. The single best one is mindfulness-based practices. And she talks about this as a skill that not only helps with resilience, which we know is bouncing back, but presilience. It trains us to get through stressful situations. And we think about what our attention does. It helps us focus on a task. It can help us notice what's going on around, or it can help us plan and manage. This can be done in our cognitive functions, in our social functions, our relationships, as well as emotion. And the best way to do this is through mindfulness. And she's studied the Army. She studied NFL and Division I football players, medical specialists, especially the ER and surgeons, as well as first responders. And in high-stress situations in all of those fields, attentional function degrades. And mindfulness practices preserved intentional function and outcomes in every single group across the board. So mindfulness has a number of scientifically backed benefits. It trains neuroplasticity. It helps us overcome the default mode, which is where we worry and dwell and get really upset about what happens on our daily basis. It improves executive functions, our ability to pay attention, facilitates flow states, which are highly enjoyable, and can decrease stress and improve mental well-being. So it helps with stress, it helps with emotional development, it helps us communicate, be creative, it helps our physical health, it helps us learn, and it helps us teach. And I'll wrap up by saying mindfulness is mental conditioning. So I like to, when I give lectures like this, I ask this question: how many people work out on their physical health on a regular basis? It could be once a month, once a week, right? Almost everybody in the room does something for their physical health. How many people train their mental health on a regular basis? Yeah, much less hands. We use our brains, you could argue, in what we do a lot more than we use our physical skills. And so mindfulness can be formal. I sit every day and have a formal meditation practice, but there's lots of ways you can work on mindfulness without sitting cross-legged and repeating a mantra. It can be informal, it can be active. Put a number on it. You can walk, you can hike, you can run, you can cook, you can garden. Science can be incredibly mindful if you're in the moment. Prayer, showers, music, art, practicing medicine can be incredibly mindful, and our relationships can teach us this as well. So the principles of mindfulness say that we need to systematically regulate our attention. We can transform a quality of an experience in the service of others in our relationships to the world. And it's all about paying attention, being in the moment, and it has three key components. Intention, so doing this purposefully, being involved in the moment and nothing else, and doing it in a non-judgmental way. So because of timing today, I'm going to skip the 10 ways to be a more mindful physician and go to the conclusions, but there's two I want to share. First is that an intention is a powerful tool for growth, and we can use this throughout our medical expertise. So training, teaching, learning, surgery, or medicine, whatever it may be, before you embark on your day, what do you actually want to learn today? What do you want to teach today? We do this in the operating room now. I'll ask the residents, all right, what's your intention for the day? What do you want to get out of our day in the operating room? I want to learn the renal hilum. I want to take the tumor out. I want to learn how to sew a kidney back together again. When we're thinking about patient outcomes, what's the goal of what we're doing? Why are we actually employing this strategy? What outcome are we trying to optimize? You can apply this to your career planning. Where do you want to be 1 year, 3 years, 10 years from now? Why are we doing it this week? What do I want to do this week? It's great to work on your physical health. It's great to be on a diet, but why are you doing that? Are you trying to lose weight? Are you trying to gain weight? Are you trying to be more muscular? Do you want to improve your flexibility? Do you want to feel better at the end of the week after work? And obviously in your personal relationships as well. And the last thing I'll say is that purpose is incredibly important. And I coach a number of people around the country, and these are some of the things we work on. First of all, the big question is, what brings you fulfillment? You can talk about values, you can talk about heroes. I think it's really important to talk about this one. How do you want to be remembered? I love this quote from the Tao: "He who dies and yet does not perish has longevity." And I think it's really important to bring up Chris here again. Chris was a complex guy. He was awesome. He had two really key values that people who interacted with him knew. First, Chris was a badass surgeon, and Chris loved his patients and the trainees he came in contact with. Those were two of his key values. That's how he lived his life, and his legacy lives on through those values. And I think we can aspire, maybe those may not be our values, but we can aspire to live a life that really showcases our values. We have to put them in the context of our life. We're each different. Identify our priorities. I love this one. You can only have one priority. That's the definition of the word. You can prioritize everything else underneath that, but you can only have one priority. After the meeting tomorrow, I'm on a plane. I'm not hanging out, because that's my priority. I can't wait to get home and see Sarah and the kids. And it makes it very clear to make that decision. Create a mission statement, put these things in writing, and then work on them. So I'll skip through the last ones, even though they're kind of fun, because I want us all to sit in a room and talk. And I'll just finish with the conclusions here. Sorry, there we go. Remember, we can only control 20%. We only have control over 20% of our wellness, but that can influence a huge impact on who we are and how we see things. Knowing who you are can combat cognitive dissonance at an individual and institutional level. Strategies for individual wellness will replicate our strategies for institutional wellness, while institutional strategies will support individual wellness. There are effective strategies that impact culture, the way we practice, and our individual selves, and mindfulness-based practices are a wonderful way to promote a culture of individual and institutional wellness in medicine. So with that, I'm happy to take any questions in a large group if you guys want. Otherwise, I'll direct you to our breakout rooms, and we'll have fun until 6 o'clock.